hey, doing intravenous vitamins and minerals can be helpful for healing. So I know we briefly talked about this when we were talking about the, just in general, micronutrients and on the oral side of things. Here is an interesting study where, a human study, these were burn patients, okay? So this is very different than a rotator cuff tear. These were also pretty serious burns that they were dealing with, okay? The average percentage of the body burned was 45%, plus or minus 20%. That's a lot of burn area, okay? But what they found here was they got daily infusions of either a placebo in the hospital or trace minerals that contained copper, selenium, and zinc. They then looked at, one, adverse events from the burn, such as infections and the need for additional skin grafts. And two, they also looked at glutathione levels, okay? Because selenium is going to increase glutathione, and so they're looking at, can we augment healing in this tissue by increasing tissue levels of glutathione without directly giving glutathione? So what they found in the patients that actually got the trace mineral infusion is that their plasma, copper, selenium, and zinc went up. Great, good. We gave them an IV of something and their blood levels went up. Cool. The interesting thing is that they saw an increase in glutathione and glutathione peroxidase in the actual tissues that they sampled from the burns. What that ended up resulting in, that's supposed to say infections. Clearly I write the word injections a lot. Decreased number of infections, and they had improved wound healing, which was measured by a reduction in skin graft requirements. So what this tells me, because they did not select patients that were deficient in copper, selenium, and zinc, but this gives light to the idea that healing can be augmented with additional support above and beyond the RDA and what we typically tend to get from foods, giving credence to the idea of, hey, doing intravenous vitamins and minerals can be helpful for healing. So then, what do we put in our IV? So these are the basic ingredients, and I'll show you ratios in a second, but these are the basic ingredients and the rationale behind why it's in the IV for our tissue healing. Vitamin C, again, coenzyme for proline to 4-hydroxyproline, which is part of collagen. Magnesium, one, because it's just a basic cofactor for the methyl cycle and like 400 other things, but it also affects migration of cells for wound healing. Selenium, glutathione production, thyroid function. Taurine, because it impacts collagen synthesis and helps with cell proliferation. Copper, again, important for the conversion of collagen and elastin. B vitamins, because methylation. Manganese is required for the activation of prolidase, which can help with the formation of collagen. Zinc, 1, immune function. 2, important in cell proliferation, can also be beneficial for testosterone levels if zinc levels are subclinically or clinically deficient. Glutathione as an augmenter for tissue healing, and then what is new in the practice here is NAD. Ooh. NAD as a signaling molecule that is involved in DNA repair, mitochondrial function, cell division, and basic metabolism. NAD, which I believe we're going to talk about in a second here, is not just an electron carrier transporter in the electron transport chain. It's actually a super really important cell signaling molecule. So here are our two IVs, one without NAD, one with NAD. Literally they are the exact same. This one has 100 milligrams of NAD added into it. which in the grand scheme of things is a pretty small dose. Most of the time, if we're going to be doing an actual NAD IV for a patient, we're looking at about 500 milligrams. But a little bit of NAD is still better than no NAD. You don't have to go the full 500 milligrams to get an effect. If you guys want to start adding in NAD into your clinical practice, there are different trainings that are out there that you can do. Anderson has some things online, some webinars and stuff like that that you should really check out, because there's science, there's things you need to know about this, because NAD is extremely powerful at activating the mitochondria, and so if you give it too fast in IV, you can give people tachycardia, you can make people feel terrible during it. Basically feels like a thyroid overdose because you're just ramping up mitochondrial activity in the electron transport chain. So it's a slow drip because it's a little uncomfortable. Glutathione, again, remember, if you have not done an IV class, please don't just throw these in a bag and think you can give it as an IV. Really go do Dr. Anderson's IV NTP course. That will give you everything you need to safely and effectively utilize and better understand why this stuff is going to be beneficial, so you can be safe and efficacious in your IVs. Oh, I thought I included an NAD article.